ineffective coping related to lack of confidence, and the fourth option is pain related to increased frequency and intensity of uterine contractions. So the correct answer is option number 4, that is pain related to increased frequency and intensity of uterine contractions. Now the next question is, a 24-year-old primigravida client who delivers a variable term neonate in order to receive oxytocin intravenously after delivery of the placenta. Which of the following signs would indicate the nurse that the placenta is about to be delivered? So the first option is the cord lengthen outside the vagina. Second is there is a decreased vaginal bleeding, and the third option is the uterus cannot be palpable, and the fourth option is uterus changes to discoid shape. So the correct answer is option number 1, that is the cord lengthens outside the vagina. Then the next question is, a primiparous client who has just delivered a healthy term neonate after 12 hours of labor holds and looks at her neonate and begins to cry. The nurse correctly interprets that behavior as a sign of which of the following? First option is disappointment in the baby's gender. Second option is grief over the ending of the pregnancy. Third one is a normal response to the birth, and the fourth is indicates of postpartum blooms. So the third option is the correct answer. That is, this is the normal response immediately after the delivery. Then the next question is, a cervix of a 15-year-old primigravida admitted to the labor room area is 2 cm dilated and the 50% effaced. Her membranes are intact and the contractions are occurring every 5 to 6 minutes. Which of the following would the nurse recommend after the client's admitted? First is resting in the right lateral recumbent position. Second is lying in the left lateral recumbent position. Third one is walking around in the hallway until she gets tired. And fourth one is sitting in a comfortable chair for a period of time. So the correct answer is option number 3, that is walking around in the hallway until she gets tired. Then the next question is, which of the following would the nurse include in the teaching plan for a 16-year-old primigravida client in early labor concerning active relaxation techniques to help her cope with pain? So the first option is relaxing uninvolved body muscle during uterine contractions. Second is practicing being in a deep meditative sleep-like state. Third is focusing on an object in the room during the contractions, and the fourth is breathing rapidly and deeply between contractions. So the correct answer is option number 1, relaxing uninvolved bodily muscles during uterine contractions. Now the next question is, a primigravida client in early labor asked the nurse what effleurage means. The nurse explained that the effleurage is a type of massage involved which of the following? First option is deep kneading of the superficial muscles. Second is secure grasping of muscle tissue. Third option is light stroking of the skin surface. And the fourth option is prolonged pressure on specific areas. So the correct answer, that is the meaning of effleurage, is light stroking of the skin surface. Now the next question is, a 24-year-old primigravida client in active labor requesting use of the jet hydrotherapy tub to aid in pain relief. The nurse based the response on the understanding that this therapy is often contraindicated for the client with which of the following? So the first option is ruptured membranes. Second is multifetal gestation. Third option is diabetes mellitus. And the fourth option is hypotonic labor patterns. So the correct answer is ruptured membranes, that is option number 1. Then the next question is, a primigravida client admitted to the labor area in early labor tell the nurse that her brother was born with cystic fibrosis. When teaching the client about the disorder, the nurse understands that his disorder is considered as which of the following? First option is X-linked recessive. Second is X-linked dominant. Third is autosomal recessive, and the fourth option is autosomal dominant. So the correct answer is option number 3, autosomal recessive disorder. Then the next question is, a physician order an amniocentesis for primigravida client at 37 weeks gestation in early labor to determine fetal lung maturity. The nurse expects the fluid sample to be tested for which of the following? So first one is amount of bilirubin present. Second option is presence of red blood cells. Third option is bare body determination. Fourth one is lecithin splenomegaly ratio, that is LS ratio. So for the lung maturity, we are checking the LS ratio, that is lecithin splenomegaly ratio. Then the next question is assessment of a 15-year-old primigravida client at term in active labor reveals cervical dilatation at 7 cm with complete effacement. Because the client is only 15-year-old, which of the following would nurse assess the client during labor? So the first option is uterine inversion. Second one is cephalopelvic disproportion. Third one is rapid third stage of labor. Fourth one is decreased ability to push. So the correct answer is CPD, cephalopelvic disproportion, that is option number 2, because the client is less than 18 years.